Welcome to the joint replacement class at TriStar Centennial Medical Center. The first portion of this class will be taught by an orthopedic nurse navigator or educator, and the second portion of this class will be taught by a member of our physical therapy team. Our program mission statement is to become the best joint replacement center in the nation by providing our patients passionate care while achieving exceptional outcomes through the use of research and evidence-based practices. Today, we are going to educate you on total joint replacement surgery and share some expectations of before and after your surgery in hopes of alleviating any stress or anxiety you may be feeling. If you have any questions, please notify your surgeon's office. In preparation for your surgical procedure, you must be cleared medically, listen to the joint education class, and go through pre-admission testing. While going through pre-admission testing, you will receive a special cleanser. This cleanser is to be used the night before your surgical procedure and the morning of your surgical procedure, unless instructed differently. The cleanser comes with a new clean loofah that is to be used to apply the cleanser. Please do not use an old washcloth. Use the cleanser from head to toe, keeping it out of your eyes, ear canals, and mouth. When drying off after using the cleanser, please use a clean, fresh towel. Once you are dry, do not apply any lotions, creams, makeup, or powder to your skin. The cleanser pack will come with detailed instructions and a diagram on how to use. Remove any nail polish and acrylic from your fingernails. Do not write on your legs. Your surgeon will initial the surgical site in the holding room. No eating or drinking after midnight the day before your surgical procedure. You will be given a bottle of Ensure pre-surgery clear nutrition drink during pre-admission testing to drink the morning of your surgery. Please drink it before you arrive at the hospital. The drink helps your body prepare for and recover from surgery. If you are lactose intolerant, on a gluten-free, kosher, or halal diet, you may consume the Ensure pre-surgery drink. Please contact your surgeon's office with any additional questions. Please identify a coach or caregiver that can actively participate with your care after surgery. You will have medications in your system that can prevent you from remembering the post-operative education your navigator will review with you. Also, it is important for your coach or caregiver to be present during your physical therapy and occupational therapy sessions, which occur the day of your surgical procedure and the morning after your surgical procedure. Their presence will help facilitate a smooth and safe transition from a hospital setting to an in-home setting. Whether it be a family member or friend, please have transportation set up to carry you from the hospital to your home. Discharge planning starts in your physician's office before you are admitted to the hospital for your surgical procedure. What this means is once discharged from the hospital, most of our patients attend outpatient physical therapy. Please get a preferred list from your surgeon's office and select one of your choice. Please visit where you plan to attend outpatient physical therapy and set up your appointments. Ask your surgeon's office what day to set up your first appointment and how many sessions to set up per week. Admission to a rehab facility is less likely in single joint replacements, and most patients go home the day after surgery. If a facility is necessary for you, your surgeon will let you know. We ask you to bring several things with you on the day of your surgery. Please bring your educational booklet that you receive from your surgeon's office. We will continue to add additional education to the booklet. Please bring loose-fitting, comfortable clothing. Clothing that works well would be shorts and a t-shirt, gown with robe, and loose-fitting pajama pants. Remember to bring clothing that you are comfortable wearing in the hallways where you will be walking. Please bring your own personal preferred hygiene items. If you forget, we do have shampoo, soap, toothbrush, and toothpaste. If you wear a home CPAP machine while sleeping, please bring it along with the tubing and mask. We will provide distilled water. Bring a copy of your living will and durable power of attorney for healthcare. If you have a rolling walker, which has rolling wheels in the front and tennis balls or skis in the back, Please put your name on it and bring it to the hospital. If you do not have a rolling walker and you have not had a piece of medical equipment covered by insurance in the past 5 years, your inpatient case manager can order you a rolling walker to be delivered to your hospital room before you are discharged home. You may also purchase a rolling walker at a medical supply company before your surgery and bring it to the hospital day of your surgery. Please put your name on your walker. Please bring a list of the medications you are currently taking. Have the name, dosage, and how often you take the medications written down. Also include a list of your allergies. Please leave your jewelry, large amounts of money, and valuables at home. Only debit and credit cards, no cash, are being accepted throughout the hospital to help contain the spread of germs. On the day of surgery, you may park in Garage B, which is located at the corner of Patterson Street and 23rd Avenue. You may park on levels B1 through B3. Enter the hospital via the connector located on level B3. Follow the connector to the hospital entrance where a COVID-19 screening is currently set up. After being screened and cleared to enter, you will be given a green armband. One support person will be allowed to enter the hospital with you after being screened as well. Continue down the hallway to the elevators, which are to be taken to the 8th floor. Please arrive on the 8th floor pre-op at the instructed time on the day your surgery is scheduled. The 8th floor pre-op is in Centennial Medical Center's main tower. A nurse will escort you to a pre-op room where they will take vital signs, review records, and you will change into a gown. Questions will be asked repeatedly by different caregivers, such as what is your name, date of birth, and what procedure are you having done. This is for your safety. While in the holding room, oxygen will be placed by nasal cannula, an IV will be started, your surgeon will speak to you, anesthesia will speak to you, and medications will be given to help you relax, and some for postoperative pain and nausea. After surgery, you will recover in the PACU, which is the post-anesthesia care unit. You will be in this unit from 1 hour up to 4 hours. Your nurse in the PACU will administer pain medications if needed. If oral pain medications are needed, a snack provided by your nurse is to be eaten before these medications are administered. Oral pain medications taken on an empty stomach cause nausea and vomiting. Your nurse will monitor vital signs and check surgical dressings and drains. Your nurse will ask you to cough and deep breathe to exercise your lungs and to begin performing ankle pumps. Ankle pumps are simply pushing your toes down and pulling back up. It is the same motion you do when pressing a gas pedal in a car. You will be asked to do 10 ankle pumps every hour you are awake. This motion promotes good circulation. Once you are ready to leave the PACU, you will be transferred to the orthopedic nursing unit located on the 7th floor. Family will be waiting for you to arrive in your assigned room. Once in your room, your vital signs will be checked and your pain level will be monitored routinely. Exercises and mobility begin day of surgery. You will be on a clear liquid diet. Once your body can tolerate a clear liquid diet, then your nurse will advance you to a regular diet. The orthopedic unit is a room service unit. You will be given a food menu with the room service number printed on the front. Please call this number to order each meal. If you do not call to order your meal, you will not receive a meal. Again, it is very important to get regular food in your stomach before you are given oral pain medications. Oral pain medications can be given once you have eaten. Pain medication is very constipating, so stool softeners will be started at bedtime. Continue performing ankle pumps 10 times every hour you are awake, which is pressing your toes down and pulling back up. It is the same motion you do when pressing the gas pedal in a car. An incentive spirometer will be provided. It is a device you breathe or suck in at the mouthpiece 10 times every hour you are awake. The purpose of the incentive spirometer is to promote deep breathing and filling your lungs with air, which will aid in preventing postoperative pneumonia. Please use the incentive spirometer while you are in the hospital and after discharge from the hospital. Pain management is very important after surgery. You have been managing an arthritic type pain, and now we will be managing postoperative pain. Your nurse will ask you to rate your pain on a numeric pain scale, with 0 being no pain, ranging to 10 being the worst pain you have ever felt. Please be open and honest with your nurse when rating your pain. It is critical for the management of your pain. You should be medicated every 4 hours as needed. The last time you received pain medication will be displayed on your hospital television. Please remember it is important to stay ahead of the pain. Our goal for you is comfort. We want to minimize your pain to tolerate movement and therapy, but we cannot promise to take all your pain away. Pain, inflammation, and bruising is to be expected after joint replacement surgery. Post-op day 1 is the day after surgery. This is the day most of our patients discharge home. This is a very busy day. When you wake up, make sure your breakfast has been ordered. This can be done the night of your surgery or the following morning when you wake up. Your nurse will come in and remove your oxygen if it hasn't been removed already. Your IV will be disconnected from IV fluids. Your Foley catheter will be removed if one is placed. If you had your knee replaced, your nurse will remove the surgical bandage and apply a waterproof bandage that stays in place over your incision for 7 days. This bandage is safe to shower in. You may not soak or submerge your incision in water. If you had your hip replaced, the waterproof bandage that remains over your incision for 7 days is placed in the operating room after surgery. This bandage is safe to shower in. You may not soak or submerge your incision in water. All patients will be given 2 emergency bandages to take home. Once your waterproof bandage is in place and the drains removed if placed, you can shower or sponge bathe and put your clothes on. Your breakfast will arrive between 7 a.m. and 8 a.m. Please eat your breakfast and take your oral pain medication. Physical therapy and occupational therapy will come work with you after breakfast. After the completion of therapy and you have been cleared for discharge by your surgeon and the hospitalist, your nurse will review your hospital paperwork for you to sign and help you pack up your belongings. A transporter will take you from your hospital room down to your ride home in a wheelchair. When you arrive home, continue using your incentive spirometer, doing your ankle pumps, and staying ahead of your pain by taking your pain medications every 4 hours as needed.
Pre-operative joint replacement education. Welcome to the physical therapy portion of the pre-op joint replacement education. Once your surgery is complete, faithful physical therapy and closely following the guidelines that your surgeon set out for you are the most important parts of your recovery, and you did not come this far to not go the distance. Why do I need a joint replacement? By the time you schedule a joint replacement surgery, you've usually been dealing with pain for a long time and have exhausted your other options for relief. You have not reached this point lightly. We are excited to be part of your journey to an improved quality of life. As we move through this part of the presentation, please keep in mind that every patient, joint, surgery, and surgeon is different. This is an overview, and your specific surgeon might have different instructions for you. If that is the case, please do as they say. Joint replacements are considered an elective surgery, which means that your surgeon expects you to have prepared everything you need for a safe recovery in advance. That is an important purpose of this presentation. We want you to have time to get everything you will need ready. This includes making sure that you have a ride to and from the hospital ready for when you're discharged. Making sure you have rides to and from your upcoming physical therapy appointments, as you'll not be able to drive immediately. Making sure that you have people available at home with you to assist meeting your needs after surgery. Making sure you have equipment you'll need to recover safely. And making sure you've prepared your home with any adjustments necessary, such as installing grab bars in the bathroom, improving lighting, or removing throw rugs. Again, the expectation is that all of these things are finished before your surgery in order to have the best recovery possible. Here we have a diagram of the hip joint. Here we have a diagram of the knee joint. Physical therapy. What can you expect in the hospital for physical therapy? If your surgery is finished and you're appropriate for therapy by 6 p.m., you can expect to see the physical therapist and the occupational therapist together. It is not uncommon for patients to have a fuzzy recollection of this therapy session, which is why it's incredibly important to have your coach or your advocate present with you and available to take notes, ask questions, and track what's going on. Depending on how the patient is doing, that therapy session might simply include standing up and walking to the bathroom or walking in the hallway. It might also include performing the car transfer and stair training in the rehab gym. These will be performed prior to discharge by each patient, so if they're not done at the first session, then they'll be done the following morning or at the next session. Hip and knee replacement patients should expect physical therapy sessions twice each day they're in the hospital, just like the 2 sessions we expect patients to perform on their own at home daily once they've left the hospital. Goals prior to discharge from the hospital. Please keep in mind that our physical therapy is patient-specific, so our goals will be tailored to each individual patient. For example, if you have not walked 100 feet on your own in the past year, we will make sure that your goal is appropriate for you. That said, we want to make sure each patient is safe for discharge. We would love for you to be able to walk 100 feet using your rolling walker. We would love for you to be independent with any surgical precautions that we might find out about after surgery, such as weight-bearing status changes. We would love for you to be independent and safe with your bed mobility and commode transfers. We would love for you to be able to complete the education on stair training, car transfers, getting in and out of the bathtub. And we would also love for you to be independent with your basic home exercise program. All of these things will take place before leaving the hospital. Prior to surgery. In terms of physical therapy, one of the most important considerations after surgery is a patient's safety getting around, walking, standing, sitting. Goal number 1 is reducing the risk of falls. So number 1, make modifications. As soon as you complete this presentation, I want you to pretend that you are being driven home from the hospital after your surgery. From the time you pull up to your home, I want you to visualize each step that you will have to take in order to get from the vehicle into your home and settled. I want you to identify any fall risks so that you can address them before your surgery. The goal is not to overwhelm you with this process, but rather to encourage you to be proactive. I'll talk you through some thoughts to consider. Remember, you are using a rolling walker to get around. If you have difficulty getting in and out of your vehicle now, it will likely be more challenging after your surgery. So think about your options. Are you able to bring a different vehicle to the hospital? Are you able to borrow one? How many entrances do you have to choose from in order to get into your home? The one that you use now might not be the easiest and safest one after surgery. Which is the safest entrance to use after surgery when you have the rolling walker? Do you have to go up any steps? If so, how many steps are there? How stable are they? Do you have any handrails that you can use? Are there handrails on both sides of you or just one? You might need to consider installing grab bars or handrails if not. If that is not an option, make sure you plan ahead and perhaps have some additional folks at your house or your home when you arrive in order to assist you getting inside safely. Make sure the people that are helping are not at risk of injury themselves. Next, make sure you temporarily remove any welcome mats or throw rugs to reduce your fall risk. You'll be using the rolling walker, so you want to make sure to remove all obstacles because you want a clear pathway through your home. Are you able to fit the rolling walker into the bathroom? Think about sitting down and standing up from the toilet. Do you have grab bars or maybe a stable piece of furniture like a vanity to push up from? Do you have a walk-in shower or will you need to get your leg over a bathtub in order to take a shower? Regardless of your setup, a stable chair or preferably a bench for the shower is helpful. Is your bed high up off the ground? Will you need a stable stool in order to get into bed? Do you have an alternative option in case your bed is not a safe height? In general, you want to avoid low chairs, soft chairs, and chairs that do not have good arms or armrests to push up from. If you complete this exercise and realize that your home is not a safe place to recover, think about your other options. Is there someplace else you could recover temporarily? The important thing is that you can work on this now. Number 2, arrange for assistance at home. It is a much better plan to have more assistance and more support lined up than you actually need than to realize after surgery that you need more help and need to request it. Number 3, arrange for transportation as needed, especially to and from your physical therapy appointments. Equipment. Rolling walker. Again, Our goal is to reduce the risk of falling after surgery. We want our joint replacement patients to use a rolling walker, very basic, very standard, nothing fancy. We just want the wheels in the front and 2 prongs in the back. We do not want patients to use a rollator or a walker with 4 wheels. Those are too unstable. Patients should expect to stay on the walker for a minimum of 2 weeks if they're a knee patient and 1 week if they're a hip patient. However, patients should not discharge themselves unilaterally from using a walker. If you feel like you're ready, then you should talk with your outpatient physical therapist and the 2 of you make that decision together. A rolling walker is only helpful if you use it. This means both hands are on the rolling walker in case you need to stabilize yourself for any reason, which also means that you are not going to carry a plate of food and a glass of water from the kitchen to the living room, dining room. This is why we want someone to be there to help you. There are strategies like putting a bag or a basket on the walker to help you get items from one room to another. We want you to know that everything you see in the movies with the walkers is wrong. We don't want you to stand with them really far out in front of you, and we don't want you to pick them up off the ground. Think of the walker as an extension of your body. It's going to move with you. You want to stand tall with good posture. You want your hips to be in line with the back prongs of the walker, and your body is staying in the little box. The rolling walker is not helpful if you walk into a room and leave it by the doorway, which I've seen plenty of folks do. Please use your rolling walker all the time until you and your therapist decide that you don't need it anymore. It's very important that you have the rolling walker in the vehicle transporting you from the hospital home in case you need to get out of the vehicle for any reason on your way home. If you are planning to bring a rolling walker from home, go ahead and put it in your trunk today so that you don't forget it. However, we do not want you to bring the walker into the hospital. For infection control, please leave it in your vehicle. At the hospital, you'll use a rolling walker that belongs to us. If you're planning to borrow a walker from a friend or relative, or if you have one up in the attic or down in the basement, please go ahead and get it out soon to make sure that it still works. Especially if it's 40 years old and your grandmother used it, we need for you to make sure that it is still safe to use. Not having an appropriate rolling walker can cause delays leaving the hospital, so please make sure the one that you're using is safe. If you don't have one and are planning to get it through insurance at the hospital, we will make sure that you have it before you leave. Straight cane. Knee replacement patients usually progress to a cane with instruction from their outpatient physical therapist. Cryotherapy for knees. Polar pack. Before I talk about the polar pack, I want to share with you some guidelines that you are going to follow once you get home. These guidelines will be reviewed with you in the hospital as well. During the day, make sure that you get up and walk around 5 minutes out of every hour the first week after surgery and 10 minutes every hour the second week after surgery. Now again, this is during the day. We want you to sleep through the night if you can. Once you're done walking around, we want you to perform your hourly exercises. By that, we mean 10 ankle pumps, where you put your foot on the gas, 10 glute squeezes, where you tighten up or you squeeze your butt muscles together, 10 knee presses, where your leg is extended, is straight, and you are pushing your knee down into the bed or the sofa, wherever you are. We also want you to do 10 breathing exercises with the incentive spirometer that you'll get at the hospital. When you're finished, we want you to ice your surgical leg and rest with your legs elevated until you get up and walk around again the next hour. If you're a knee patient, when you're resting, we want you to make sure that your knee is straight. We don't want it to be bent. It always needs to be straight or extended when you're resting. Never put a pillow under your surgical knee. This is very important. Also, make sure that your legs are elevated when you're not walking around in order to reduce swelling. In addition, make sure that you spend 30 minutes 3 times each day with your surgical leg elevated above your heart. The easiest way to accomplish this is usually for your upper body to be flat with you lying down and your surgical leg above your heart supported by a pillow, perhaps a wedge pillow. Walking, hourly exercises, elevating, resting, and icing are all critical components of your recovery. Cryotherapy for knees, the polar pack. If you're a knee patient, you'll be provided a polar pack to use at home. The polar pack has very clear and detailed instructions on the lid, and there are pictures included in those instructions. Make sure you do not put the white part of the pad in direct contact with your skin in order to avoid irritation. We always want a clean barrier between the pad and the skin. Leave the polar pack on at night and any time you're not up walking around. Be very careful, however, to take the polar pack off your leg prior to standing up in order to reduce the risk of a fall. This is especially important to consider at night if you need to get up and use the bathroom, because you'll likely be tired and groggy. You might be wearing an immobilizer brace if that is something that your surgeon asks you to do. So make sure that you take the polar pack off before you walk around. Cryotherapy for hips. Hip patients are also expected to ice their surgical leg. However, a polar pack will not be provided. Please have ice packs already in the freezer before your surgery. Hip patients should also provide a clean barrier between their skin and the ice pack. 6-week goals. Number 1, walk without a limp or an assistive device. Number 2, be able to perform a single leg stance on your surgical side for 10 seconds. Number 3, be able to perform reciprocal stairs with or without the use of a rail. Number 4, be able to perform a sit to stand from a chair without pushing up from the arms. And if you're a knee patient, be able to achieve active range of motion, which means that you are bending your knee. The therapist is not bending your knee. active range of motion of 0 to 120 degrees. That means your knee is straight and flat at 0 degrees, and you get a bend of 120 degrees back towards your bottom. Don't. Basically, we don't want you to go rogue, and we don't want you to do too much too soon. It is absolutely possible to do too much too soon after your surgery, and we want to avoid that. Please stick closely to the plan that your surgeon and therapist have given you for recovery. It might seem very simple and therefore not important, but following this plan can help avoid serious complications. 5 minutes of walking and standing each hour for the first week means just that. It doesn't mean 20 or 30 or 50 minutes walking and standing. Unfortunately, we have plenty of stories of patients who decided to cook Thanksgiving dinner, or they went to a party and they felt great standing up for hours, only to wake up the next day unable to walk due to swelling. These patients have even asked us to share their experiences with you so that y'all don't have to go through what they did. If you are wanting to get back to a specific activity, please don't just start back on your own without consulting your outpatient physical therapist or your surgeon. If it is not on your list of physical therapy exercises, we don't want you to be doing it without specific permission. You should, however, be performing your physical therapy exercises from your outpatient therapist 1 time every morning and 1 time every afternoon. So that's 2 physical therapy sessions every day. And on the days that you go to the outpatient clinic, that counts as 1 session, and you would then do only 1 more session on your own at home for a total of 2. The big key is to not overdo. We do want you to communicate any concerns that you have immediately. Thank you so much for your time. We wish you the best, and we're excited to see you. Thanks for listening.